Why Wefunder? Urgent EMS Incorporated recognized early on there would be a need to generate significant capital for our vision of a next-generation telemedicine hybrid. We use the word hybrid because our vision straddles physical and virtual healthcare services. Video-based healthcare solutions can only provide limited meaningful use services. In general, video-based telemedicine services do not include vital signs monitoring, heart, lung sounds, or their monitoring systems. Additionally, most video-based telemedicine solutions are focused on primary care or highly specialized. We believe in addressing the patient as a whole. By being a hybrid solution, we have the ability to work with physicians, nurse practitioners, physician assistants, nurses, EMTs, paramedics, and allied health professionals as a whole team to bring healthcare to the patient. Wefunder is a unique platform that allows startups to access capital using equity crowdfunding, similar to Kickstarter. Unlike Kickstarter, investors are investing, not just contributing funds towards the startup process. Our goal when starting the Wefunder was to create opportunities for non-accredited investors to make meaningful investments in a startup company. Most healthcare professionals are not accredited investors, but understand that the delivery of healthcare is changing, and the true healthcare is a team, not just physician-based. Right, the physician is the coach, but it is the allied healthcare team that carries out the plays. We believe most telemedicine systems are so focused on connecting the patient with a doctor that they fail to close the loop on the process required to provide meaningful healthcare. Wefunder will allow Urgent EMS Incorporated to tap into the large pool of allied healthcare professionals who have historically been refused access to startup investing. Urgent EMS Incorporated chose Wefunder to represent us because they are a leader in the area of equity crowdfunding, a concept that has only been legal since 2016. They have a track record of raising tens of millions of dollars successfully for emerging startups in all phases of development. As an early startup with a concept and basic plan of action, with working relationships with multiple vendors who will be integrated into our network, Urgent EMS recognized that Wefunder gave us a unique opportunity necessary to defy the naysayers, while creating a valuable company without selling our dream to large investors at this early stage. Our Wefunder offering will be a safe, simple agreement for future equity, which is a unique instrument that converts at a future date to actual stock at a discount rate of 80%. The safe agreement means your investment will turn to shares for 20% less than the value set at the conversion event. Additionally, the first $50,000 raised will be held in escrow and cannot be withdrawn until released by Wefunder. Should we fail to hit our minimum $50,000 raise, the funds will be returned to the investors. Our initial goal is to raise $249,499 to finish documents to extend our raise to the maximum of $1,070,000 so we can raise under Regulation C, at which point we can enter a Regulation D round, raising up to $10 million to capitalize our startup's operations. The additional advantage of using the SAFE instruments is these instruments do not create debt for Urgent EMS Incorporated that could cause our company to become insolvent at a future point in its growth cycle. Currently, Wefunder has placed a market cap of $1 million for the first $100,000 raised, after which our market cap will be $2.5 million. The investor who invests the first $100,000 will also have a 30% discount with that $1 million market cap, improving their position at the future conversion point. In closing, please do your due diligence, but we believe the Wefunder will allow our investors, both accredited and not accredited, to experience the benefits of being early investors in a startup company.